regarding epilepsy, another area where we have problem is the new anti-epileptic drugs. Several new anti-epileptic drugs have been introduced. The family physician may not need to prescribe them, but they sometimes have to deal with the side effects of the newer drugs. Like you said, kidney stones can occur due to due to topiramate. Then there are several other drugs. So how can you just introduce us to some new drugs and their side effects at least?
I think this is a very important point which should be discussed and family physicians should be aware of. That in the last decade or so, there are almost 7 to 8 new compounds have been added in the epilepsy. If you go to the history of anti-epileptic drug development, the last drug which was introduced in the late 70s was sodium valproate. And then for almost 20 years, we had no new drug coming. And in the 90s, we have seen 30 of drugs coming up in the last decade, almost 7 8. Now, for us today, I think the new drugs which should be remembered, which are commonly being used now, is first is oxcarbazepine, which is not very difficult to remember. It's just like carbamazepine, it's a derivative of oxcarbazepine. The only difference between carbamazepine and oxcarbazepine, one has to remember, is oxcarbazepine is supposed to be devised as a molecule, supposed to be safer. It has less agranulocytosis, less hepatic side effect and all that. But one side effect which you should remember particularly in your practice, which is clinically significant, is the higher incidence of hyponatremia. So anybody who uses oxcarbazepine and develops dullness or problem, drowsiness, check their sodium. So we in fact every time person comes with oxcarbazepine, comes to follow, we always insist on doing serum electrolytes and check the sodium. But the next, apart from that, there are not many side effects to remember. It is very well tolerated. It does have usual CNS-related side effects of the anti-epileptic drug, that is drowsiness, dizziness, double vision, you go to a higher level, but pick those side effects as we call it. The second common drug which is now being used is levetiracetam, which is available in various forms like Capra or Vegapine. This Capra is the main company, which is all international name. Now this drug is very good drug. It is something like a derivative of paracetam. Paracetam, the nootropic or age-old compound which is being used by everyone for most of the indications in neurology. So now this is a good drug in the sense it has less interaction potential. That's why it can be used as a monotherapy, particularly in elderly with epilepsy. Because if the elderly person has, as you see, there's a big drug list. He's on antihypertensives, on antidiabetics, and so on and so forth. So if you want to add any new drug, you want to reduce the interaction. And that's why in this situation, we find levetiracetam fairly safe. It is again a broad spectrum drug, in the sense, it can be used in people who have partial epilepsy, that is epilepsy starting on one side of the brain, versus people who have generalized epilepsy, in which many areas of the brain are simultaneously affected. So this is drug to be remembered. It does not require much monitoring. Only side effect one should worry about, particularly in children, is it increases irritability and can cause a little bit of aggressive behavior. That's the only thing which I'm worried about. No systemic side effect up till now has been reported on long-term use. So it's a fairly safe drug, and the drug interaction potential also is very minimal. And of course, CNS related side effect because of these drug doses can happen, drowsiness and double vision and all that. The third, of course, lamotrigine, which you already mentioned. The point I want to make about lamotrigine, two important points to be used. It's again a broad spectrum drug. It's a drug which is going to have, the next question which was going to ask me about is used in childbearing age group. So, first the lady who has epilepsy and who is going to child pregnancy, we prefer to use lamotrigine now, because up till now, pregnancy registries which have been mentioned on lamotrigine have shown that the teratogenic side effect of lamotrigine is less than 2%, and at the best one can get it. Now, only side, the drug interaction potential is there, particularly with other anti-epileptic drugs. So, for example, if you combine lamotrigine with sodium valproate, the sodium valproate inhibits the clearance of lamotrigine to the extent that half-life is increased from, say, 8 to 12 hours to 60 hours. So, your dose of lamotrigine has to be reduced whenever you combine with sodium valproate. As opposed to this, if you use enzyme-inducing drugs like oxcarbazepine or tegretol, or phenobarbital and lamotrigine, you require a slightly higher dose because it increases the clearance. And the most important side effect we are worried about is the drug rash. The Stevens-Johnson syndrome and drug rash is one of the commonest side effects of lamotrigine, and peculiarly, it is a dose-related phenomenon. So when you start with, say, the initially 25 milligram dose and then you build it up, the drug rash may not appear till the person reaches about 100 milligram or so. So even if a person who is on lamotrigine, say after that, early as possible in order to prevent it from going into Stevens-Johnson syndrome full blown. So this is as far as most of the other drugs, anything else? Already, topiramate again is used not that commonly nowadays because of the side effect potential, and which are really enumerated. Some of the important to remember that sometimes it produces change in your refractive error, particularly people with myopia. If you give them lamivudine, they might say that suddenly their number has increased tremendously to the extent they have to go and get it checked. So if you find that, just remove it. It is usually reversible, so one need not worry about it. It's some sort of retinopathy which you develop. Glaucoma is another side effect of topiramate. Weight loss is an advantage. In fact, the initiator, particularly topiramate, you are worried about is hyperthermia and metabolic acidosis. So if you use a pediatric population and person is on topiramate and is developed fever with no sweating and high fever, and particularly in summer months they develop these complications, most common in northern part of the country where the temperatures are very high. So this is one important side effect, not so common in adults of course. And nephrolithiasis occurs to the extent of about 10 to 15%, but it's not supposed to be clinically significant because when you develop nephrolithiasis, if topiramate is helping epilepsy control, we still continue it with the advice to take a lot of water.